great pleasure to introduce Dr. John Walters. As I mentioned, John is our clinical director here at NIIM. He has over 30 years' experience. John has a very long CV, but basically the purpose of tonight, John, one of his special interests is general dermatology, including dermoscopy, the management of skin cancer and skin surgery. So it's over to John.
Thank you for coming out tonight. Yes, the skin, it is a big organ, and about 2 square metres of it walks in the door of every consultation that we have when an adult patient arrives. It's been estimated that about 15% of all general practice is some sort of dermatological skin-related problem. The skin can itch, it can burn, it can become red, it can become swollen, it can develops cancers, and particularly can lead to stress and psychological problems. So it's something that can affect people a great deal in their lives. The skin is the way we interface with the world. So people may have a relatively trivial blemish and it can cause a great deal of stress and distress. I'm sure Ali and other speakers will talk a bit about that, looking better to feel better. Many skin conditions cause such discomfort and distress that it impacts people profoundly later in life. So it can lead to loss of confidence, low self-esteem, and diminished quality of life. Well, how did I become interested in skin? I grew up in Melbourne, and when I was a relatively young doctor, we moved up to rural Queensland. We lived on the Darling Downs, and the Darling Downs is very hot. Every day is sunny, so it's 360 days of the year of bright sunshine with no clouds. And so this was very drying and very good at fostering the growth of skin cancers. It also, this area of Queensland has about twice the incidence of allergies to what we have here in Victoria. So the asthma and hay fever were very, very common. Queensland is a huge state. Where we lived in Queensland was further away from Townsville, which is only 2/3 of the way up the state, than it was from Melbourne. So west of Brisbane, there were no allergists. So I studied allergies and started an allergy clinic, and Medicare told me that we were running the largest allergy practice in Queensland at that point. And then some patients started coming from 2, 3 or 4, even 4 hours away with rashes. And they said, "We've heard you're good at treating rashes." And I thought, maybe allergic rashes, but not skin in general. So then I decided to do dermatology training in Hong Kong and the UK. And I did some plastic surgical and surgical training in Queensland. In Queensland too, there are only at that stage, there are only 2 dermatologists west of Brisbane in the whole state. So you could go like 2,000-3,000 kilometres and there'd be no dermatologists. So whatever the local doctors could do, that was all that happened. So it didn't take very long before I was seeing thousands and thousands of people with skin problems and skin cancers. And by the time I left Queensland, I was cutting out more than 800 skin cancers a year. I also became interested in the overlap of allergies and skin problems. This is a list here of some common and not so common allergic or autoimmune skin conditions. And these can all cause a variety of distress with people. Without going into any one condition specifically, how do we manage autoimmune or allergic skin things? As with all integrative medicine, I have a relatively simple approach, and these are the 3 cornerstones of what I like to talk about with patients. Firstly is the minimising stress and being as relaxed as possible. We know that patients with cancer all do better if they're relaxed. Stress depletes our energy and makes almost anything that we suffer with worse. And as I mentioned earlier, a lot of these skin conditions are distressing and provoke anxiety and distress in their own right. So these rashes can cause stress, and stress can aggravate the rashes. The second thing to look at is diet. A healthy diet, which is usually with an emphasis on plants, good oils, and restricting carbohydrates and avoiding sugar. The largest organ of immunity in our bodies is the gut microbiome. And years ago, we used to think that those 2 kilograms of bacteria in our gut were all waste rubbish, but we now know that they modulate our immune system. And so gut health is an extremely important contributor to overall health and important to address in people who have autoimmune conditions, including autoimmune skin problems. The third thing is exercise. And exercise makes everything better. It's as good as an antidepressant. It helps patients with virtually any disease repair and heal and feel better. I like people to do exercise that they enjoy. I personally ride a bike, and I don't like seeing people on the bike track going out for a jog who look like they're being tortured with every step. And unfortunately, there's a few of those there, and I feel like asking them to go home and rethink their whole program. Outdoor exercises have a specific benefit. Well, when patients come along in general for skin-related conditions, what do they ask about? One of the commonest things that I see is that as we grow older, and you'll hear more about this, all the functions of our skin diminish and tend to wear out. This little gland on the side of the hair follicle, or here, these are oil glands or sebaceous glands, and they wear out. So once you get over 50, everyone is going to more or less develop dry skin. And I think of the skin a bit like leather. If you have a leather belt or a saddle or shoes, and you wash it with soap and water every day, and it's out in the sun, it's going to need oiling to maintain it. Otherwise, it'll become dry and cracked and wear out. Caring for our skin, but with moisturisation, is not just a cosmetic operation either. It actually reduces the skin disease and deterioration, and it is preventative for skin cancers. So it's an important thing to moisturise our skin. 2 ways of doing that. One is moisturisers on the outside of the skin, and the other way is with internal moisturising, and that is oils, fish oil, flaxseed, ground flaxseed oil, and of course lots of olive oil. When we're outside enjoying ourselves in the sun, what do? This is just approaching the Flinders Ranges in one of my favourite places, but it's always hot there and it's always sunny. Well, this is Huey, my grandson, on 14 Mile Beach, looking out over the Indian Ocean in Waiora Station in Western Australia and covering up. First thing, of course, is to get in the shade and then to cover up. Here I am. When do we need to use more protection than covering up? When do we need to use sunscreens? I keep this on my phone. This is just a SunSmart app. And sometimes it's obvious, a summer's day, but other days you're not quite sure. And the SunSmart app is handy because it says the UV is now 1, maximum UV day is 2, so you don't need to worry about it today. And it'll give the rating. It just gives you a bit of a guideline, a bit of a help, because just in case you're not too sure. And if you're going to use sunscreens, what sort of sunscreen do you use? There's been a lot of talk over years about sun protection factor, SPF, 10, 15, 30, 50. Doesn't really matter very much. SPF, it's a logarithmic scale, so SPF 15 absorbs about 93% of UV light. SPF 50 is 98%. So any of them main thing is to use them when you need to, and any of those are all right. There are also a couple of classes of sunscreens which are worth considering. The commonest ones that we see are the chemical sunscreens, the photoabsorbing ones, and they're the ones with the long chemical names on the back. They absorb the UV light. The other type are the physical sunscreens or photo-reflecting ones, and they're zinc oxide, like cricketers smear all over their face, or titanium dioxide. These are possibly safer because they reflect the light, but they are also not so cosmetically acceptable because you have a little glisten to them, or they may even look white. So when we're out in the sun, we're taking care of our skin in these ways, heading off into the sunset on a little track near the Flinders Ranges. Remember that the skin, it's a wonderful thing, keeps the outside out and the inside in. Thank you.